a lot of physicians are fighting for Medicare patients. And so fighting for those insurances to get the contract. I have seen where someone held their line on their contract and the insurance company went across the street and thousands of lives changed hands. Today we have the pleasure of having Dr. Michelle Pearlman here, and we're going to talk a little bit about medicine, the transition of her practice, and kind of what she got into from training on. So I'm going to start this off really easy, Dr. Pearlman. Tell us a little bit about your training, your background, and what brought you into medicine.
All right, so this goes back probably, let's say, 15 or 20 years. So I was always interested in nutrition and exercising, really starting from middle school. That was really my therapy. So I understood the foundation and the importance of really self-care and setting those boundaries. And then I went through my undergrad and I went to medical school, and I really wanted continuity with patients. I think initially I wanted the excitement of being in the ER.
Okay.
And then I realized I'm not someone who just wants to meet someone for the first time and never see them again and never figure out what happened. And then, oddly enough, I started competing in bodybuilding. So then I started learning about the whole fitness industry and how so much of that is actually very unhealthy and creates very unhealthy eating behaviors and exercise. And throughout medical school, I remember competing on and off, and they would actually have to kick me out of the gym when they closed because I was so OCD about getting 2 hours of cardio in every single day. So I've kind of been through the gamut with myself. And then, I was in California and then Dallas, and I did my training in gastroenterology. And imagine suffering from bloating or heartburn or constipation, diarrhea for decades. And then you go to your doctor, you wake up from anesthesia after your endoscopy, and they say, "Hey Bob, great news, everything's normal." You think Billy or Bob or Sue is happy? They're not happy because they want an answer. And so through all that, I figured, you know what, we have to tackle the foundation: nutrition, movement, stress management, sleep. I could do all the endoscopies in the world. If I'm not really tackling the underlying issues, I'm not helping a lot of people. I wasn't filling that gap.
It's interesting. I had this conversation today. I kid you not. One of my friends is waiting for his GI to get back to him. Went to the Baptist portal. He's freaking out because even though the office kind of said, the radiologist said everything looks okay, he has a couple cysts and things like that, and he's freaking out. So then he made a nephrology appointment, which obviously there's not a lot of those here in Miami, Florida. That's months and months out. And so he's built up all this anxiety. And now that, with his actual health and his original issue, are completely blown out of proportion to a certain extent. They've intensified greatly. And it's because it's so difficult as a normal traditional specialist to have that care, that time with your patient, because they want you to crank out the endoscopies and all the procedures.
Yeah, the typical gastroenterologist in private practice is seeing 30, 35 clinic patients a day, whether they're new or follow-ups. And then when you're scoping at a surgical center, you may be doing 25 procedures in a day. So a lot of these places are scope mills or clinic mills where if you need to have nuanced conversations with people who have been struggling for symptoms for decades, there is no way you can provide valuable care in a 15-minute visit. There's just no way to do that. So then what do people do? They doctor shop, right? And that in healthcare has such a negative connotation. But the reality is people are desperate for answers. They have to go from one doctor to the next because they're not even getting one opinion.
Right. And I think with the system being so big, and we were talking a little bit about earlier that 73% of all healthcare physicians are employed by a big hospital or some corporate entity, including private equity or whatever that is. So these businesses, these healthcare businesses, are so large that although a primary care sent it to you and you're in the system, there's just so many patients. You're seeing so many patients. The primary care is seeing so many patients. It's so difficult to get the time from a patient perspective to get the answer you want, or potentially it's checking off boxes to see if someone has something that's dangerous. So I think patients get very frustrated too, because maybe from an endoscopy or whatever procedure you did, they're clear, but you're not getting to the base of where these symptoms are coming from. So I noticed you didn't mention some of the places you worked, and I don't want to go into them if you don't, and that's okay. But you've obviously traveled a little bit, worked in different places. You worked in a university setting, correct? And so what was like the point where you realized, you went through all this training. You did internal medicine, then you went to GI, which is how many more years?
So 4 years of medical school, 3 years of internal medicine, then 3 years of gastroenterology and hepatology. And then I was at the University of Miami as faculty for 4.5 years. I started as a general gastroenterologist, but then kind of melded my practice into really solely weight management. So I started the weight management program there.
Oh, okay. You started at the university. That's fantastic. Yeah. And so then what made you decide to make the transition into private practice?
A lot of things, actually. I think one is particularly when it comes to weight management. So I could see 2 patients with heartburn in a 30-minute, 40-minute period, right? If someone is struggling with weight issues for decades, and they also have metabolic syndrome, so insulin resistance, high triglycerides, visceral fat, and I need them to lose weight, there's no way I can do that sort of visit in a 15-minute slot. So for me, when it comes to weight management, it requires more hand-holding, particularly with these newer medications on the market with the GLP-1s. There's no way I can start someone on a medication, titrate it every month, and when they ask me, Doc, when am I going to see you back? And I'd say, I'll see you back in 6 months. It just wasn't realistic for my practice. Now, for many people, that sort of setting works perfectly well. It's just with what I do and my niche, it just wasn't a good fit. And that's just not where I was. That's really healthcare in general, where it's a volume game.
Correct. So you're seeing, those are complicated patients. And so weight loss is one of the things that need to be attributed to. But there's kind of like, in my opinion, and I'm going to give it to the professional second, a lot of those diseases can become better or a little more optimized or stabilized by helping someone reduce their weight and their visceral fat. You want to talk a little bit more about that? Because, I mean, that's really complicated, and I'm going to... And you probably saw that for sure at the university, because the university sees very complicated patients. Are you still seeing that today too, is my second question to that. So like, was that just something you saw there? Or you're also seeing it now and you transitioned to the private? And then how have you seen all that kind of come together and affect those patients? It's
everywhere, right? So now I think it's, 1 in 2 people have diabetes. 1 in 2 American adults have diabetes. I think 40% of adolescents have prediabetes. 1 in 2 people have high blood pressure. So all of these things factor into metabolic syndrome. We're looking at 2/3 of the American population are overweight or obese. It's become the new normal, okay? So that when people come into clinic, it doesn't even register a lot of times. When someone's BMI is, let's say, 29 or 33, it's become so normal. It's not really a red flag for a lot of healthcare providers, because those are the majority of patients that we actually see on a more routine basis if they're coming in for high blood pressure control or whatnot. So I had a very large practice at the University of Miami. And so what I saw was, what brings people through the door, and even in my practice today, is they're coming to me for weight loss, okay? But you can go on any Medi Spa or any of these quick weight loss centers. All of those centers are focused strictly on weight loss, on selling weight loss. So although that's what brings patients through the door, they also understand that that's not actually my priority. My priority is improving their cardiometabolic health and really improving their health span, not just lifespan. So those are typically the patients that show up in my office today at Prime Institute, are people who are ready to invest in their health. They understand the importance of building muscle, eating protein, changing their behaviors, working on their sleep, and then potentially using medications as a tool to make the process 2 things: a little bit less painful and a little bit easier, but not painless and not easy.
That's definitely a different patient than at the university. But so that's interesting. So I think, we live in a big city. Obviously, everybody here is talking about the weight loss medications. You're looking at that from a much broader perspective and how it can help that person. So people come in for the weight loss. So how have you been able to expand your reach to get more people to come to you, and as opposed to going to like one of these quick weight loss clinics?
So I'm very grateful. Being in Coral Gables is an amazing place to be, because I think when you look at other sort of areas, people are more health conscious here. And also these medications are quite expensive. So a lot of people are coming to me specifically for management of the medications, and they also have the financial means to afford the medication. Okay, so those are critical factors, is that it's easy for a physician or a provider to put the script in for the medication. But if insurance doesn't cover it, and many times they don't, it is a big healthcare cost. Okay, and so I forgot your question.
How have you been able to grow your practice with so many competitors and so many, everybody's offering weight loss, you know, and you're doing it differently. But it's still, there's a lot of people doing that. So how have you been able to expand your reach and get more people to see you and then understand your concept versus what the quick fix is?
So the beautiful thing is, the way I look at it is, competition is a wonderful thing, because if there's no competition, that means there's no market, right? So if you have all these little places that are selling weight loss, a lot of times you're not quite sure who you're seeing. You're not quite sure what their training background is. A lot of these smaller companies are using compounded formulations, and you have no clue what is in those medications because there's really no regulation whatsoever. There's a lot of virtual clinics out there where you may meet with someone, but no one's really testing your biometric data, what's really important, which is your visceral fat and your muscle mass. So a lot of these companies are offering everything for everyone, but they're not really personalized, and they're not many times high level, looking at that person, all the comorbid conditions, and also speaking with, let's say, the primary care doctor. So most of my patients, it's not actually from search engine optimization or YouTube videos, which is different from my sister's practice. Most of my patients are actually local, Coral Gables, Pinecrest, some in Broward, who are referred by their primary care doctors. So how did we establish that referral network? When my sister and I first started, what did we do? We reached out to like 60 different providers across all different specialties and said, we'd love to meet you. We want to know, what do you do? What sort of patients do you like to see? This is what we do. This is how we can collaborate and help each other with our mutual patient.
Do you think that's something doctors normally do, or doctors kind of keep to themselves and not collaborate except outside of the referral pattern?
Yeah, it's interesting. When, you know, in my prior job, I didn't necessarily need to go out of my way to get referrals, because through the typical insurance model, people just showed up on your schedule, right? So you don't necessarily realize the importance of networking and building your reputation on the clinical side. When I left, you know, the reality is you have to bring in patients. You cannot expect people to just call up and say, I'm ready to schedule, particularly because we're out of network providers. So you have to build trust within the local community, build your brand, and develop a reputation with a lot of providers in the area. So, but I was never taught any of that. I never did any networking because I didn't necessarily have the need for it, but it's absolutely essential. If you don't want to spend $20,000 on a public relations team to try to get your name out there. Most of my patients come from word of mouth and referrals from healthcare providers.
Did you know that when you started your practice, that you need to go and collaborate and meet all these people? Was it an idea? Did someone give you that idea? You're like, well, I need to find a way. How did you come to that process to meet 60 people? That's a lot, like aggressive. I think a lot of people would have been like, after 5 would have been like, I don't want to do this anymore, because it's not easy. It's not easy.
Well, the reality is everyone wins, right? So I see a lot of patients who need a dermatologist, a rheumatologist, an endocrinologist. So if they're seeing me and they're looking for that point person, and I say, oh, I've been in Coral Gables for 6 years, I have no clue who to send you to. I don't really look like I, you know, am well established in the area. When you have connections of really good providers, and then you say, you know what, I'm going to call so-and-so, and I'm going to say, you know, Dr. So-and-so, look out for this person's call, and then they get them in the next week or two, everyone wins. The provider sees patients they can help, my patient's getting help, right? It comes full circle. But I think, you know, in the typical healthcare scenario where it's like a rat race and you're on a hamster wheel, you know, a lot of people don't really think about that aspect.
I think there's two sides to it. So when you open your own practice, like, and you go into this kind of service-oriented concierge-style business, people aren't flooding through the doors because you're not accepting insurance. So you do have to rebuild a network with like-minded or people that are seeing your kind of clientele that you like to help. What you also did, what I think is fantastic, you're like, you figured out what that physician likes to see and not see. And if you could provide something in their gap and help them with their patients. So if they're sending, and I know you deal with some concierge medical physicians that do primary care and they don't want to deal with this side of it. Now you're all working together for the same goal for that patient. And it just, everybody wins, because the person that sent it, the concierge doctor that sent it to you, now the patient's doing better. All their labs are better, they're optimized, they're seeing results on the lab side, they feel better, they look better, they're losing visceral fat, so everything's kind of coming together, so it's a win-win. So I think that's one thing I think, like you said, physicians don't know. You have to rebuild this network, because it's not an insurance network. You need to think of who's seeing this patient that's willing to pay cash, that's willing to pay for this service, and wants this kind of service. And a lot of the times, and people ask me, well, what's the avatar of a concierge patient? I tell them, it's interesting. You can come down to kind of, this is what it looks like. There's people with a lot of money that refuse to pay and only want to use insurance. And there's people with less that see their healthcare as a priority, and they're willing to, what you said earlier, invest in their healthcare, in their longevity, in their well-being. And that's kind of the person that you want, and they're going to be you're going to develop a relationship with them.
Yeah. Now, it wasn't all like flowers here, okay? So we made our mistakes.
No way.
We learned
you didn't hit this perfectly out of the park right off the bat.
Because we spent $20,000 on a PR firm.
Oh, you did do that?
Oh, we did. Even though when we reached out to other medical providers and said, how do you advertise? And I had several of them, concierge primary care doctors, say, do not pay for ads in magazines. I've been in Ocean Drive. I didn't get any referrals, right? Do not pay for a PR firm. Those are not where your patients are coming from. It is word of mouth, right? So I heard that, and I didn't listen. And I said, okay, let me try a PR firm and see how that pans out. And the reality is, what I learned from that after doing it for about 3 to 4 months is my patients weren't looking at Healthline or Forbes. They're reading, let's say, the local news or the local TV, or they're talking to their friends. How did they lose weight? So we learned a valuable lesson. But I think the key point there is you just have to be able to pivot, right? If you do something, you give it a couple months, you don't give it 2 years. If it doesn't work, then you change. And I think that is often challenging to do, particularly when you put in a big investment to then say, okay, that probably wasn't the best idea, but I'm not going to waste any more money on that.
Yeah, because maybe it can work for some people, but you keep putting tens of thousands of dollars with no outcome, you're going to run out of what you need to keep this open, to see patients, to take care of them. So,
and I think once you put yourself out there and you start branding, then you get a lot of people reach out to you on LinkedIn or social media and say, oh, I'll create videos for you. I'll do this for you. And you do a test run and you see, oh, I can get more views on my own than paying someone $3,000 a month to make videos, So you have to figure out what's going to work for you, because as you become, more well-known in the area, people kind of come out of the woodworks and try to figure out how they can potentially help you when in fact it may not be so helpful, particularly for a startup. It's a big expense.
Yeah, and as a startup, like, you kind of want to bootstrap as many things as you can. There's nothing more powerful than word of mouth. And so when people ask me, well, what makes a good service-oriented concierge practice, or you need to take care of the patient. And when someone refers you that patient, you need to take care of them, and that will just evolve over time. But it also takes time to build that revenue. But so you have to be in it. So you cannot burn through unless you have it. And there are some people in the area that did have that to start off, and good for them. But most people don't.
Yeah.
So you have to kind of figure out, where am I going to get the best ROI? And it's just honestly doing what you do best, which is kind of like your motto when you entered medical school, is like taking care of the patient. It's just our system makes it very complicated. And there's nothing wrong with the traditional medical system. There's a lot wrong. But what I'm saying is the doctors in that system are doing their best. They really are.
Yeah.
And it's difficult, and it's very difficult for the patient. But I do see this industry is going to grow. I was talking earlier about this, is that the 27% of people that are not owned by one of the big entities, there's going to be such an opportunity just to have this relationship, and build these super teams amongst physicians and collaborate, where I think a lot of physicians didn't do that, especially in this area, because a lot of physicians are fighting for Medicare patients. And so fighting for those insurances to get the contract. I have seen where someone held their line on their contract and the insurance company went across the street and thousands of lives changed hands. And that's crippling for someone trying to do their best and trying to make a reasonable living for it.
Well, the cool thing though about this community is initially my sister and I wanted to be the jack of all trades, right? And offer everything for everyone, employ an exercise physiologist and a dietitian and a psychotherapist and a sex therapist. And then we realized we don't want to manage people. We don't want to manage other people's schedules. But what we can do is if we have this referral network, then it's great. We don't have to manage their schedule, but we have their cell phone and say, so-and-so needs to see you, can you expedite their appointment? And then we don't have, 5 different providers on a payroll and then, living kind of paycheck to paycheck.
Oh yeah, and that just creates more chaos. Yeah. But even that, what you said earlier, I want to commend you, like being able to get people in within a few weeks for any specialist, actually any physician or anybody else that can help them is not heard of. And that's where the value of this kind of healthcare, this kind of concierge healthcare really comes into play, and having this direct patient access. Like it helps navigate people through a system that is so complicated and difficult. So I have to commend you and your patients for optimizing health. You said something a little bit earlier.
Oh, what did I say?
I'm trying to go back.
What did I say?
It wasn't that bad. I know it was. You're kind of talking about how people kind of jump and look for other physicians because they're not getting the answers they want. I think this is also why online there's all these non-physicians kind of taking over these spaces. And we talked about there's all these health clinics, maybe with or without a doctor, that somehow are getting their hands on some of these medications or promising the world. And it's kind of diluted what medicine and healthcare and wellness are. You have any thoughts on that or anything to say about that?
Well, I think it's partly our fault as healthcare providers in the healthcare system. Like for my sister as a urologist, she's trained as a surgeon. I'm a gastroenterologist. I was trained as a proceduralist. So most of the money we brought into the hospital was doing procedures, okay? So if someone is struggling with a lot of gastro issues, it's easier for me to do an endoscopy and a colonoscopy and make money for the healthcare system offering that procedure than it is for me to sit down with someone for an hour to go through their history. And the reality is insurance doesn't pay you for an hour. They pay you for 15 minutes.
And the reimbursement between a procedure and you talking to someone is completely different.
Yeah, so I think the healthcare system has failed our patients because it doesn't allow for proper access. It doesn't allow for proper time. And patients are desperate. So where do they go? They go online, they go to these virtual clinics, they go to the clinic down the street because they're offered some of that one-on-one, maybe not that high-level expertise, but at least they can talk to someone for maybe a little bit longer, I don't know. So part of it is just the system. We've created that, and it all comes down to education. We blame people for going to Dr. Google, but the reality is an after-visit summary with a couple sentences is not good enough for education. And we can't just tell our patients, oh, go in the GI Society guidelines and read about heartburn. We need to curate the information, send people which videos they need to watch, which articles do they need to read, give someone a starting kind of guideline or journey to follow instead of making them kind of figure it out on their own. When it comes to nutrition is very simple, but it can also be very complicated. So particularly for patients who have a lot of bloating, we tell them go on a low FODMAP diet. Have you heard of that diet?
No.
It basically is cutting out kind of gas-forming foods like broccoli, cauliflower, garlic, onion. So healthy food, high fiber food. So if someone comes to me for bloating and I say, here's a packet that's 20 pages, cut out all these foods that can cause bloating. They walk away and say, well, I'm trying to eat healthy. What in the world am I supposed to eat? It's saying I can't have a lot of fruits and a lot of veggies. What do I eat? So then they eat pizza because it's considered, let's say, low FODMAP. So we don't really guide people on what is the step they should follow this week. We kind of just give them a bunch of things and say, kind of figure it out on your own, and I'll see you back in 6 months.
Yeah. And that's
so we can't blame them for going on.
And you can't, they don't have any follow-up, so they go in they go to Google and they figure it out, and they think they're eating
so
healthy
it all
and they're
starts
making
with
it worse.
education, but then at the end of the day, insurance does not reimburse you for education. So we have to figure out, even if people are not able to do a concierge practice or whatnot, there are still ways that we can build our brand, build our online presence, create that educational material on social media platforms to help well-informed patients. But that takes time and that takes money, and universities don't pay for that either.
We're working on that right now as we speak, as you speak.
But believe it or not, my sister and I, before we ever even thought about starting this practice, invested probably $20,000 on building out an educational website for our patients. So that when patients said, where can I go for this information, we had our landing page and said, go here for some X, Y, and Z blogs. But a lot of people can't do that.
Yeah. I mean, that's interesting. That I think all that is really good, but you're right. We leave people out on an island, and it's very difficult for them to figure out and make the correct decisions, and they don't have anybody to speak to. And you're the professional, so there's no access because that's what insurance dictates. That's the problem. So I think that's kind of where I got this started, and why I'm here to talk to professionals and specialists like you is that I think there has to be a point now where physicians start taking the helm and start getting out there, and maybe they can't afford to come see you, but they can get the appropriate information from the appropriate people. And then if you're a physician that's interested in getting into this kind of practice, know that there's a way to do it, and we're going to come up with different ways to try to help you, and things that you can hopefully get in an educational standpoint from a physician standpoint. So what are some of the things that you wish you knew when you were starting your own practice that you had to learn the hard way, besides a $20,000 PR firm thing?
So I truly believe that everything happens for a reason, and sometimes the things that don't happen were really not meant to happen. So initially, I had a non-compete, so I was looking at places like in Hallandale and Fort Lauderdale, and I thought I needed a whole custom build out when I was ready to open. So I found...
What year was this, by the way?
What year?
Yeah.
2 years ago.
Okay.
Yeah.
So we're post-COVID. Okay.
Yeah. So I was looking around at places. I had a broker. There was a brand new medical office building under construction, actually in Hallandale. So I do a walkthrough with one of my friends who used to have like a general contracting company. And this place was probably going to cost $250,000, probably even more. Was probably going to take 2 years to build, 2,000 square feet, and I had to basically design it from scratch. Now, I can pull off a construction hat, but I don't know anything about construction. So we were doing a walkthrough, and my friend is walking through. He's like a 67 years old, but knows everything about everything. And he talks to the developer and says, I'm sorry, this layout does not make sense. No one's going to see the door at the end of the hallway. The stairwell is like jetting out in front of it. So these little things that didn't even come to my mind. So things were a little bit shady about the place. My sister and I applied for a Wells Fargo medical loan for $250,000, and we were denied because we weren't going to take insurance, and they couldn't fathom the type of medical practice we wanted to start. So thank goodness we were denied, because then I couldn't, get the loan for this custom build out. So it ended up working out beautifully, because I literally rented a 100 square foot office at a Quest workspace in Fort Lauderdale. And that's where I started my practice. So I would meet my patients at the elevator, and I would walk them to my room. We had an assistant who worked remotely from home, and that's how I saw patients and built my practice. So it was funny because most of my patients were coming from Coral Gables. I was driving from Coral Gables. So my patients would be like, I'm driving from Coral Gables. You're driving from Coral Gables. Why don't we just see each other in Coral Gables?
Why don't you just jump in my car? I'll just drive around.
So I commuted, 2.5 hours a day for a year. When my sister started her practice, she was doing virtual visits from her apartment downtown, then started subleasing from a plastic surgeon's office. So it wasn't until, it wasn't until a year in that we actually moved into our office in Coral Gables. But at that point, we had a thriving practice where we were actually using the space, and rent was just another bill. It wasn't, really causing a big dent in our revenue. So as much as it was exhausting and annoying to have a 100 square foot office in Fort Lauderdale, we would have been bankrupt before we ever started if we did the whole custom build out. So I think the kind of tip there is your dream practice will not be the practice you have from day one. You have to grow into that.
You have to build it.
You got to build your practice first, get into a space that you can then actually optimize.
Yeah, build it and they will come. So I love that because I'm very familiar with the, wait, you don't want to take insurance? We're not giving you money.
But it also allowed us to see where were our patients coming from, right? So I actually built like a Broward network. So now my patients from Broward come here and I see them on Saturdays so they don't have to hassle with traffic. But it gave me a year to figure out where the patient's coming from. And I saw, okay, they're coming from Pinecrest and Coral Gables. That's where the office needs to be.
Yeah. So when my practice opened, there was a non-compete, and it was time and distance, and so that was a whole fight in itself. Then you go through the bank saying no, and you're like, where am I going to find the money? You know, and then you're fighting with your former employer from a physician standpoint, and you move out, and you're like, okay, this is not what I envisioned. It was like a little rinky-dink office. We knew the bulk of the people were in the Gables, and they did follow, just like people followed you because you were doing a great job. So that does its own thing. And then some people didn't follow because they didn't want to drive, and that's okay. But one of the patients found a custom desk that his friend was throwing out. He was a GC, came and fixed it up and made it very presentable. And it was a very presentable, okay office, but it wasn't the dream. And then I also went through that, okay, the non-compete's ending. Where do we go? Where are our patients? And there are patients. It was in Pinecrest. A bulk of our patients at the time were in Pinecrest, but I was like, well, people in Pinecrest, this was a guest though, so you used data, which is great. Shop in the Gables probably, or have to go eat in the Gables. So I think this is the move. And so we did kind of like a marketing. We asked them all like, well, you're gonna move. You're right down the street from my house. Well, don't you go to Merrick Park? Don't you go? Yeah, we do actually. Okay, well, you can go to Merrick Park and visit the office. And then that whole thing between the banks and getting the loans and building it out. So there's a lot going on, but you can take it step by step. But the most important thing is when you take care of the patient, you will build your practice and you will eventually get there. And you have to kind of visualize and realize that it's just a building game and you have to go down that road to get to where you want to be. And that's still going to change over time because as you touch more lives and maybe expand your practice and expand staff and all these things still evolve a little bit. And if you're not evolving,
you're dying.
Get left behind. You do die, yes. Here we are with our cell phones and cameras. We're not fighting cats outside. Thank goodness, big cats. But yeah, so I love hearing those stories because I love the resilience. It's not easy.
Yeah.
It's very hard, number one, to become a physician. And then it's not terribly hard if you don't do anything wrong to accept insurance and get patients. You're going to get patients, especially in a healthcare system or a hospital or university. It's very difficult and you have to learn a lot of things when you go out on your own. And on top of that, you don't accept insurance. That's just the next level. Because as a GI, actually, if you would have came out and accepted insurance, you would have been absolutely fine. Because there's several month waiting lists to see a GI unless it's urgent here. So that is just another level of difficulty that you added, and you were able to be resilient and overcome.
Well, and people would ask us all the time, why are you out of network? And the reality is we would just be recreating a broken system, but now be responsible for all the overhead, right?
Yeah.
So it's just taking a lot of the problems one location and then just taking them all to another location. It didn't make sense.
You would have to see a lot of patients.
Yeah.
You would have to see a lot of patients, a lot of staff just to keep the lights on. And then you break even at X patient, you can eventually calculate that. I remember a primary care physician telling me, I'm gonna hire you, hiring a physician, I'm gonna hire you. Anybody you see over 47 patients in a day will be your bonus for the year. One day. I mean, that's a lot, right? So like, it's very expensive to run a medical practice. Either way you go, but a traditional one, you just had to still see the volume.
Well, it's all about impact, right? You know, I could see 30, 40 patients in a day, but if I want to have a really big impact on them long term. And maybe not even just the one person sitting in front of me, but also their family. So I have some patients that actually bring in their kids.
Which I didn't mean to go there. I was just saying, had you left and done GI, you still would have, you're right, you would have taken that problem and just moved it to your own practice and been responsible. But you're right, the impact that you have by
Oh, I know what I was going to say. So I don't see pediatrics, but if I have my patient sitting in front of me and they say, you know, my daughter who's 14 is really struggling with nutrition, I will let them bring their kid in and we'll go over basic nutrition, right? So I take an extra, let's say 30, 45 minutes, I take them into my snack room. I go over healthy kid-friendly snacks. I go over normal structure and function of the GI tract. So I'm not only helping my patient, I'm also helping to create that healthier household atmosphere because I can educate other people in that household.
Oh, that's nice.
So it offers a lot of opportunity. Yeah.
But tell me, we talked a little bit about the weight loss medication and doing that. What else excites you? What else are you bringing to your practice that kind of works cohesively with what you're doing with the weight loss and treatment, helping all these disease states? What else excites you in the industry or that's coming up or something that you focus on besides the medication side of it? What else do you do?
So although my primary practice is not GI, I actually offer like second and third opinions for gastrointestinal disorders. So I'll have patients bring in all their records, I review everything, and I'll say, okay, based on what you're telling me, I would actually recommend this, that, and the other. And then they can go back to their primary gastroenterologist and have a more well-informed discussion. So I do offer that. I just don't offer a lot of the more detailed and intricate diagnostic studies like diagnostic endoscopies or breath testing for SIBO, but I can at least guide people in the right direction on what questions to ask and what to ask for. So that's part of my practice. And then I also do kind of sports nutrition, how to just build muscle over the lifespan, whether or not people want to lose weight, but if they are focused on building muscle, I do some sports nutrition, endurance training. So one of the coolest parts about my practice is what brings people here is to lose weight, but then when they get towards their end of their weight loss journey, then they surprise themselves. And so I have one patient who just finished a marathon, actually. He's lost about 40 pounds.
Oh, wow.
He has more muscle today than when he started, and that's even training for 2 half marathons and a full marathon in San Diego.
And that's a lot of cardiovascular, so
exactly.
you can definitely burn a lot
So
of
that's the
muscle
beautiful thing is he came to me initially to reduce the visceral fat and help more with the metabolic syndrome aspect, and now he's training really as an endurance athlete. So making that transition, there's so much stigma and bad press when it comes to these weight loss medications. But oftentimes it's because they don't have the hand holding, they don't have the supervision. People are not telling them, okay, you had this much protein a day for the past month, you lost muscle, what do we need to do for the upcoming month? Or your training schedule is changing. Now you're going to be doing 15-mile runs on Saturdays. When should you do the injection to prevent hypoglycemia? How should you change your nutrition now that you're not just lifting weights, but you're doing an endurance training? Most people who handle these medications don't have background in sports nutrition. They are not gastroenterologists. They don't understand normal structure and function of the GI tract. So me as a gastroenterologist, if I'm using these weight loss medications where over 50% of people may have a GI symptom, I need to figure out how to minimize those risks. Bringing in my GI background allows me to do so.
And your sports nutrition from
Exactly.
your previous life.
Yeah.
That's awesome how those two kind of worked out down the line. Did you kind of see that happening, or you always kind of wanted to put them together?
Well, I've always been very fascinated with all these things, and so like this is my dream job or career because I can meld everything together, which is really amazing. You know, I truly believe in this statement, you don't work, when you love what you do, you don't work a day in your life. Mm-hmm. I used to wake up just through training and just in my, you know, prior training and jobs and whatever, I would wake up with a lot of anxiety because when my day started, I was already behind. When you're double booked at 8 a.m. and then have another one at 8:20 and another one at 8:40, every patient you see, you're apologizing for being late.
Right.
Now, I will never double book a patient. I have gaps in between patients in case they come late to allow them some grace, right?
Right.
So it's a lot just less stress for me, a lot less anxiety. I can provide the care that I want to. I can practice medicine the way I think it should be practiced.
Yeah, that's one thing I tell people when they ask me about medicine. I'm one of the two things. Number one is there's an art of medicine, mm-hmm. and it's been lost because in the system, you're told kind of what to do and what has to be done. But you're trained to have somewhat of an art of medicine, and then bringing out all these other things and bringing them together. That's amazing to optimize the outcomes. And the second thing is, like, we live in a sick care, not a healthcare system. We've had this conversation, and it's like we're waiting to get sick. We're waiting to get fully overweight. Well, I'm glad people are finding, hey, let me work on myself and get this going, you know, because there's so much you don't know how good life can be until you start feeling good, you know, and because 2/3 of patients, like you said, are overweight, and that's their norm, that's their baseline of how they feel. They don't know any better, and so that's what they expect. And if you can get yourself healthier and seek the attention you need to get yourself to the best place possible for you, your family, whomever that may be, for your friends, that changes so many things. And then I think it's awesome that you will also help out the family members, because when you're helping someone that doesn't really know, usually that's what they teach, you know, and that's what they know, and that's what they kind of spread. So to continuously spread that, you're really spreading the health and the wealth towards the other generations of that family. So
well, and we don't live in bubbles, right? So if I have, you know, a 50-year-old woman in my office, and she has, you know, a husband that's also struggling, and kids who are eating a ton of unhealthy food late at night, if I only help her, she's going to struggle because, let's say, there's candy or cookies at home, right? So if I can teach her why it matters, how it can actually improve the focus and attention and productivity of her child, then we're going to create a safer place at home, which is going to help everyone become a healthier version. So really, it's not just treating the patient in front of me, it's really the whole household and their friends and their family, that when other people start looking at healthier behaviors of their friends, they want to mirror that, you know? They don't realize, I think a lot of people, doesn't matter how much money you have or how successful you are, my patients are the smartest people I've ever met in my life. Being overweight has zero to do with a lack of motivation or discipline. Metabolic factors and high stress and working long hours and being at the computer and traveling and dining out for work-related reasons make it 1,000,000 times harder, you know? So it's really just people need an understanding on what is that next right step they can take, not making perfect choices, but how to integrate healthier behaviors within their day-to-day that is realistic long-term. And we as healthcare providers oftentimes forget to give people those tools when they leave the office. What we typically say is, eat less and move more. I'll see you back in 3 months, and if you don't lose the weight, I'll refer you to bariatric surgery, or I'm going to put you on a statin, or this, that, and the other. When we don't provide the tools, let's say for the next week, like this week, I want you to cut down on the sugar you put in your coffee. That one little step has nothing to do with calories, but may actually impact their hunger and cravings at 10 o'clock at night. Just taking that one positive step in the right direction.
It's your fault, by the way, that when I drink coffee with sugar, I was on my way here, and I text, hey, you want coffee? And I was like, why am I even asking? And then I grab it, and it was disgusting with low sugar. Won't say where I got it from. And I had a little bit just to pick me up a little bit, and then thank you for the tea, much healthier choice. But yeah, no, it's those small increments, and I don't actually have a lot of willpower, so I understand, like, having cookies, a sleeve of Oreo cookies in my house is not a good idea. So I completely understand. So yeah, you're right. You're also teaching good habits, and good habits over time have a compound effect on your choices you make, on the choices of your family. And so if you can do that, you're giving them a lot of tools necessarily to do what they need to do to live healthier lives.
Well, and we have to address why it matters at this particular point in your life. So if there's a 20-year-old guy who comes in, and let's say for my sister's practice, right? He may not care about vaping and heart disease or lung issues when he's 60. He probably cares about having strong erections. So if she says vaping constricts the blood vessels, it's going to have an impact on your erections, that's going to resonate to a 20-year-old instead of saying it could increase your risk of heart disease when you're 60. So for a lot of my patients, they have to be very productive during the day, and they're attorneys, and they have to do a big litigation or go to trial next week. What matters to them? Quality sleep. So drinking a bottle of wine at night is going to have an immediate effect on their quality of sleep. When does their day start? The night before. So maybe it's just tackling the alcohol at night to improve their sleep quality so that they're not dragging the whole, subsequent 12, 14 hours. That's why it matters to that person at that particular time in their life.
I did hear the vasodilation thing for you 20-year-olds, so stop vaping. we're gonna have the other Dr. Pearlman on too, so we'll go deep dive on that one. I did not know that, and I do not vape, thank God, nor am I 20. So, is there anything else you like to talk about? I mean, I feel like we've hit most of my points.
Yeah, I think the biggest thing is you're never going to feel ready to take a leap. You know, my sister and I took the biggest risk we've ever had to. Okay, I went 6 months with 0 salary. We ended up not taking out a loan. We got a line of credit for cushion. We built our practice from nothing. But what we did is we surrounded ourselves with people who had done it before, who were both personal and professional mentors within the healthcare space, but then also surrounded ourselves with people outside of healthcare who were innovators, who were CEOs of major businesses, who knew actually how to run a business, because most healthcare providers do not. So we surrounded ourselves with really smart people who had built businesses, sold businesses, understood healthcare, understood what sort of target demographic we were looking at. And that's how we were successful. We made mistakes, but we asked a lot of questions.
I'm not going to speak for all doctors, but I feel like that's not a common thing, because you guys are the alpha intelligent, hyper intelligent. So that took a little bit of humility. I think life in general will be successful. If you surround yourself with the right people, you'll do well, but also obviously in business. So you did, like, what you all did is absolutely fascinating. But building that network of people that could help you, and also those people are the kind of people you want to see too. Those are the kind of people that coming in, you can ask those kind of questions. I meet some of the most fascinating people through concierge medicine. Unfortunately, we can't say who they are, but they're some of the biggest movers and shakers in our town in Miami, which is a very large and serious growing city. And I remember saying I would love to meet that person. And sometimes I get to meet that person. They might be an athlete, a businessman, or whatever they are, and it's just absolutely fascinating. And I've also, some person when I was much younger, my crush, I got to meet them too. I was like, oh my God. But you get to meet some of the most intelligent people, like you said. So it's when you surround yourselves with that kind of people, and you don't have any issues asking those questions or saying, hey, I know you from somewhere. Then you never know where anything can go, and you never know what you can gain. And I think having that kind of, there's a term for this, a Japanese term for this, but a beginner's mind, I think a shoshin, that can change everything. And I'm sure you're going to continue because you've had the success. You've seen what it can bring out, collaborating with people and getting to know people. And people just want to genuinely help you. Those are people you want to surround yourselves with. And when you do that and you're going to make a change in your business, now you have like an advisory board of just good people that are going to give your opinion, and you're going to do what's best. And you may have to change it or adapt to the situation. But that's part of opening a business. If you stick to yourself and you keep doing the same thing over and over again, had you done the same thing over and over again, we probably wouldn't be sitting in your beautiful office. But you took the humility, you went out, you learned what you needed to learn, you met the right people. I'm sure you met plenty of wrong people, and you figured out, who can I work with, who am I having a good time with, that I can talk to, that's going to give me the great advice. And here you are, and you've built such a wonderful practice. I'm so glad that you took that leap. But you also did say it is not easy, but
the alternative also wasn't easy, right? So
correct.
You just have to ask yourself, how do you want to spend your days? And 10 years from now, would I be happy doing what I'm doing today?
And am I willing to take that fight to go? And I think right now there's a breaking point for some physicians, and they're seeking to hear this kind of story, to see how people have done it, to hopefully provide another referral network for our practices, to bring someone else in that can help and add value to the people in the community. And I think it's just going to be a wonderful, thriving community, especially in large cities. And I think in some smaller ones too, because it's just, our system is not what it needs to be. Overall, it can work for some people, like we talked about, but this is going to be an opportunity for people to get the healthcare they want. And hopefully over time, we'll have more clips from wonderful specialists like you out there that are helping people get their own information so they can make more well-informed decisions while they wait to see that physician. And I think that's going to help benefit so many people over time. So I thank you so much for your time. Your story is awesome, and we'll continue to develop our relationship so I can continue to learn how all these people that are so much smarter grow their practices.